Hello and welcome to AmericanCME's presentation of the OCMCA Transportation Protocol, Hospital Edition. Emergency facilities receive patients from incoming EMS units and have a vested interest in ensuring that the right patient is triaged to the most appropriate hospital. This presentation will summarize the hospital's role in ensuring that patients are transported to a facility that is appropriate for their condition. So what EMS patients are appropriate for your emergency facility? The basis for that decision is the OCMCA Transportation Protocol 6-28, which establishes a standardized decision-making process for EMS personnel when selecting a destination facility. This protocol is available at OCMCA.org. Please email any questions regarding this presentation to qi@ocmca.org. By the end of this short presentation, you will be able to list and describe the emergency facilities that are appropriate for all Priority 3 medical and trauma patients. List and describe the emergency facilities that are appropriate for Priority 1 and 2 medical patients. List and describe the 6 medical conditions that require transport to an emergency facility with specific capabilities. And list and describe the emergency facilities that are appropriate for Priority 1 and 2 trauma patients. EMS classifies all patients that they are transporting as Priority 1, 2, or 3. All OCMCA emergency facilities accept all Priority 3 medical and trauma patients. A Priority 3 patient is an ill or injured person that requires medical attention but does not have a life-threatening illness or injury. Patient preference will likely be the deciding factor in the destination facility. If no preference, patients will be transported to the closest OCMCA emergency facility. Priority 1 medical patients are critically ill with an immediate life-threatening condition. Priority 2 medical patients are considered seriously ill without an immediate life-threatening condition. Priority 1 and Priority 2 medical patients will most likely not get to choose their destination facility and will be transported to the closest appropriate facility. The OCMCA Transportation Protocol requires that EMS must transport Priority 1 and 2 medical patients to the closest appropriate facility. This assures that the right patient is transported to the right hospital so that they may receive the right care that they require. There are 6 types of Priority 1 and 2 medical patients listed in the Transportation Protocol that require transport to a specific type of emergency facility. Each of these conditions has its own appendix within the protocol, which lists the OCMCA emergency facilities that can handle that specific medical condition. When receiving an EMS notification of transport, be alert for patients that are beyond the scope of your emergency facility. STEMI patients require reperfusion therapy at an interventional cardiac facility as soon as possible. Only accept a STEMI alert patient if your facility is considered to be an interventional cardiac facility. Appendix 2 of the Transportation Protocol lists all of the approved OCMCA interventional cardiac facilities. Patients experiencing ROSC will likely benefit from the capabilities of an interventional cardiac facility as well. In most circumstances, accept ROSC patients only if your facility is considered to be an interventional cardiac facility. Again, Appendix 2 of the protocol lists all of them. The needs of a Priority 1 or 2 burn patient can be most effectively managed at a burn center. All OCMCA approved burn centers are located outside of Oakland County. Appendix 3 of the Transportation Protocol lists the approved burn centers. Prior to transporting a Priority 1 or 2 burn patient, per protocol, EMS must obtain online medical direction to bypass closer OCMCA hospitals that are not burn centers. For EMS to transport a Priority 1 or 2 burn patient directly to a burn center, the physician providing medical direction must first approve the request. It is up to the physician providing medical direction to determine if the patient is stable enough to bypass a closer emergency facility and transport directly to a burn center. This determination is based on the physician's communication with the EMS crew on scene. Highly effective communication between EMS and the physician is critical. If medical control determines that the patient's condition is not stable enough to make the trip to the burn center, the physician may direct EMS to transport to a closer emergency facility in order to stabilize the patient. These situations may include patients that suffered a significant trauma or patients that have a compromised or unsecured airway. Again, medical direction determines the transport destination for Priority 1 and 2 burn patients. The debilitating and time-sensitive nature of stroke requires transport to the closest appropriate stroke center. Do not accept a stroke alert patient if your facility is not a stroke center. Appendix 4 lists all of the approved OCMCA stroke centers. Priority 1 or 2 medical patients with a gestation greater than 20 weeks need to be treated in an obstetrical facility. Appendix 5 of the Transportation Protocol lists all of the approved OCMCA obstetrical facilities. OCMCA defines a pediatric patient as less than or equal to 14 years of age. Priority 1 or 2 pediatric patients may be transported to any hospital listed in Appendix 1. However, EMS is required to obtain approval from the receiving facility prior to beginning transport. If the pediatric patient is beyond the capabilities of your facility, please inform the EMS unit to transport to a more appropriate facility. There are currently Level 1, 2, and 3 trauma centers throughout Oakland County. EMS providers will triage Priority 1 and 2 trauma patients based on the 2011 guidelines established by the American College of Surgeons Committee on Trauma and CDC guidelines. The criteria found in Appendix 6 of the Transportation Protocol should be available to hospital staff receiving communications from EMS units. Do not accept any Priority 1 or 2 trauma patients that are beyond the capabilities of your emergency facility. Again, pediatric patients are less than or equal to 14 years of age. A Priority 1 or 2 pediatric trauma patient should be transported to a pediatric trauma center. Appendix 6 of the Transportation Protocol lists all of the approved OCMCA pediatric trauma centers. OCMCA Transportation Protocol 6-28 establishes the standardized decision-making process for EMS personnel when selecting an emergency facility for their patients. This assures that the right patient is transported to the right hospital so that they may receive the right care that they require. Again, this protocol is available at OCMCA.org. While EMS personnel do a great job, hospital staff serve as a fail-safe when the patient's illness or injury is beyond the capabilities of your facility. If you realize the patient being transported to your facility is beyond the capabilities of your emergency facility, please speak up. Help to ensure that the patient is transported to the right facility. This concludes AmericanCME's presentation of the OCMCA EMS Transportation Protocol Hospital Edition. Please email any questions regarding this presentation to qi@ocmca.org. Thanks for watching and have a great day.